Good morning. My name is Ondina Love, and I'm the CEO of the Canadian Dental Hygienists Association, which I'll refer to today as CDHA. Thank you for joining us today to talk about the public perceptions of the state of oral health care in Canada. Before I begin, I want to thank dental hygienists across the country who provide essential oral health care in a variety of settings, ranging from traditional dental practices to mobile, to community, to long-term care, and more. Today kicks off National Dental Hygienist Week, and this year's theme, Oral Health for Total Health, reminds us how important preventive oral health care is to overall health. I'm joined today by Sylvie Martel, Director of Dental Hygiene Practice, and Juliana Jackson, Manager of Policy, Research, and Government Relations for CDHA. We're here to talk about recent results from a survey conducted for CDHA by Abacus Data, who are leading market research experts. The data is focused on three key themes: coverage, access, and behaviors related to oral health, Canadians' feedback on federal funding for improved access to dental care, concerns regarding seniors and their access to oral health care. 7 in 10 Canadians visit an oral health professional at least once a year. The primary means of access is through employer-sponsored dental benefit plans. This still leaves a significant gap in dental benefits coverage. According to our survey conducted this year, 32% of Canadians reported that they do not have any dental benefits coverage from their workplace, a family member's workplace, an educational institution when you're talking about students, or a government program. This is down 40% in 2020 from 40%. That's a shocking 8% drop. Most appointments were for routine checkups and exams, which is consistent with trends for 2020. Dental hygienists are independently regulated in all provinces in Canada. They are essential healthcare professionals, but they don't just work in dental offices. You will find them in independently owned dental hygiene clinics, long-term care facilities, homes, schools, and on the road, improving access to oral health care in communities across Canada. In 2023, 1 in 5 Canadians report making an appointment directly with a dental hygienist in their own practice. Among under 30-year-old Canadians, this proportion jumps up to 1 in 3. And 83% reported feeling comfortable seeing a dental hygienist for oral health care in their own practice, which is up 3% from 2020. Even within the context of the COVID-19 pandemic and transmission risks, the vast majority, 9 in 10 Canadians, say they are comfortable attending a dental or dental hygiene appointment today. It's not surprising when we asked Canadians whether they supported government-funded dental care, 88% agreed that the recently announced dental care program should be implemented. Another 87% of Canadians believe the program will improve access to dental care services. It's clear from these numbers that Canadians feel strongly about the gaps in their access to oral health care. Last week, the government announced that it will be providing dental care to all Canadians with a family income under $90,000 by the end of 2025. This program is a historic investment in dental health care and the broader healthcare system, and is a game changer for millions of Canadians who cannot afford the care they need. In December, the government launched the Interim Canada Dental Benefit for children under 12 with family incomes under $90,000, providing upfront payments of up to $1,300 over 2 years. In this program's short history, over 250,000 children have received the dental and dental hygiene care they need. Our dental hygienists have shared many stories of parents being so proud that they've received the money from this program, which allowed them to bring their children in for their first dental or dental hygiene appointment. The next phase of the new Canadian Dental Care Plan will include people with disabilities, children under 18 years of age, and low-income seniors who meet the income criteria. Though most Canadians believe the program should prioritize both preventive and restorative work, of those who only choose one priority, a preventive emphasis is more popular, which is the primary focus of dental hygienists, preventing disease. Let's move on to the important discussion of seniors' oral health. Concerns regarding seniors and their access to oral health continue to rise from 2022, with the majority of Canadians feeling both seniors' financial and physical access, as well as their awareness and education around proper oral health care, are a serious problem. Specifically, 86% of Canadians feel that seniors face financial constraints that make it hard for them to pay for oral health services, and this is up 6% from 2022. A strong majority, 81% of Canadians, also believe there's a lack of adequately funded government programs for seniors to support their oral health. This is up 9% since 2022. In addition, just under half of Canadians continue to assume that oral health services in long-term care homes is minimal or non-existent. These numbers point to the necessity of the government's dental care program. CDHA was encouraged to see the Government of Canada put serious dollars behind the success of this program. There is a clear and increasing alignment between Canadians and the government that oral health care services have fallen too short for too long and must be addressed. As we studied seniors' oral care, we asked Canadians if they believed oral health care should be included in the national standards for long-term care. An overwhelming 92% of Canadians agreed with this. We are very pleased that oral health care has been included in the national standards for long-term care, but implementation and enforcement strategies are needed to ensure seniors receive the oral care they need. What these numbers mean is that we're on the path forward, and that Canadians overwhelmingly believe access to oral health care services needs improvement and government support. Dental hygienists across Canada look forward to providing care to the millions of Canadians who now have access under this new Canadian Dental Care Plan. As we celebrate National Dental Hygienist Week, if you happen to see a landmark in your community lit purple, that's the dental hygiene color. I ask you to reflect on the importance of oral health and the work that dental hygienists across the country are doing to prevent disease. In the immediate and coming years, we look forward to helping educate Canadians about their oral health in these programs. And we will continue to work relentlessly to ignore the gaps and reduce the gaps in access for all. Thank you.
Merci beaucoup, Ondina Love. Alors, bonjour, je m'appelle Sylvie Martel et je suis la directrice de la pratique de l'hygiène dentaire au sein de l'Association canadienne des hygiénistes dentaires, que je vais maintenant appeler ACHD. Merci d'être avec nous aujourd'hui pour discuter des perceptions du public concernant l'état des soins de santé bucco-dentaire au Canada. Avant de commencer, je tiens à remercier les hygiénistes dentaires de partout au pays qui fournissent des soins bucco-dentaires essentiels dans divers milieux de pratique, notamment des cliniques dentaires traditionnelles, des cliniques d'hygiène dentaire mobiles ou communautaires, des résidences pour personnes âgées et plus encore. C'est aujourd'hui que débute la Semaine nationale des hygiénistes dentaires, sous le thème « La santé bucco-dentaire pour la santé générale ». Ceci nous rappelle à quel point les soins de santé bucco-dentaire préventifs sont importants pour notre santé générale. Je suis aux côtés de Mme Ondina Love, chef de la direction, et Juliana Jackson, gestionnaire des politiques, recherche et relations gouvernementales à la CHD. Nous sommes ici aujourd'hui pour discuter des données récentes d'une enquête menée pour le compte de la CHD par Abacus Data, des experts en études de marché. Ces données se concentrent sur 3 thèmes clés. Le premier, la couverture, l'accès et les comportements liés aux soins bucco-dentaires, les réactions des Canadiens à l'égard du financement fédéral pour un meilleur accès aux soins bucco-dentaires et les préoccupations concernant les personnes âgées et leur accès à des soins bucco-dentaires. 7 Canadiens sur 10 consultent un professionnel de la santé bucco-dentaire au moins une fois par année. L'accès se fait principalement via les régimes d'assurance dentaire qui sont obtenus via l'employeur. Cela laisse un vide important dans la couverture des soins dentaires. Selon notre sondage de cette année, 32 % des Canadiens ont déclaré ne pas avoir de couverture pour les soins dentaires, soit une couverture offerte par les employeurs, une couverture par un membre de leur famille, un établissement d'enseignement ou un programme gouvernemental. Ce chiffre représente une baisse de 40 % par rapport à 2020, une chute étonnante de 8 %. La plupart des rendez-vous consistaient d'examens de routine, ce qui est conforme aux tendances qu'on a vues en 2020. La profession d'hygiène dentaire est réglementée de façon indépendante au Canada, dans toutes les provinces. Les hygiénistes dentaires sont des professionnels de la santé essentiels qui ne travaillent pas uniquement dans les cliniques dentaires traditionnelles. Vous les trouverez dans des cliniques d'hygiène dentaire indépendantes, dans des établissements de soins de longue durée, des foyers pour personnes âgées, des écoles et même sur la route, avec comme but d'améliorer la qualité des soins et l'accès aux soins bucco-dentaires de toutes les populations canadiennes. En 2023, Un Canadien sur 5 déclare avoir pris rendez-vous avec un hygiéniste dentaire qui est en pratique autonome. Chez les moins de 30 ans, cette proportion grimpe de 1 sur 3. De plus, 83 des répondants déclarent se sentir à l'aise de consulter un hygiéniste dentaire en pratique autonome pour leurs soins bucco-dentaires. Ça représente une hausse de 3 par rapport à 2020. Même dans le contexte de la pandémie de la COVID-19 et des risques associés de transmission, la grande majorité des Canadiens, 9 sur 10, se disent à l'aise d'aller à un rendez-vous pour des soins dentaires ou d'hygiène dentaire. Il n'est pas surprenant que lorsque nous avons demandé aux personnes vivant au Canada si elles appuyaient les soins dentaires financés par le gouvernement, 88 convenaient que le programme de soins dentaires récemment annoncé devrait être mis en œuvre. Un autre 87 des Canadiens estiment que le programme améliorera l'accès aux soins dentaires. Ces chiffres indiquent clairement que les Canadiens sont très sensibles aux obstacles qui entravent leur accès aux soins de santé bucco-dentaire. La semaine dernière, le gouvernement a annoncé qu'il offrira des soins dentaires à tous les Canadiens dont le revenu familial est inférieur à 90 000 d'ici la fin de 2025. Ce programme est un investissement historique dans le domaine des soins dentaires et du système de santé en général. Il change la donne pour des millions de Canadiens qui ne peuvent pas se permettre les soins dont ils ont besoin. En décembre, le gouvernement a lancé la prestation dentaire canadienne provisoire pour les enfants de moins de 12 ans dont le revenu familial est inférieur à 90 000 Les paiements initiaux peuvent aller jusqu'à 1 300 au cours des 2 prochaines années. Au cours de cette courte histoire de ce programme, plus de 250 000 enfants ont bénéficié de la prestation et ont reçu des soins dentaires. Nos hygiénistes dentaires nous ont fait part de nombreuses histoires de parents très fiers d'avoir reçu de l'argent du programme pour avoir finalement pu organiser et fixer un rendez-vous ou un premier rendez-vous d'hygiène dentaire ou dentaire avec leurs enfants. La prochaine phase du nouveau régime canadien de soins dentaires comprendra les personnes handicapées, les enfants de moins de 12 ans et les personnes âgées à faible revenu qui répondent aux critères d'éligibilité. Partout au Canada, les aînés font face à des défis importants pour accéder à des soins de santé bucco-dentaire. La plupart des Canadiens estiment que le programme devrait accorder la priorité autant aux soins de prévention qu'aux soins de restauration. Cependant, parmi les personnes qui choisissent une seule priorité, la prévention est la plus populaire. L'objectif principal des hygiénistes dentaires, c'est de prévenir les maladies bucco-dentaires. Passons à la discussion importante sur la santé bucco-dentaire de nos aînés. Les préoccupations concernant les personnes âgées et leur accès à des soins de santé bucco-dentaire continuent d'augmenter depuis 2022. La majorité des Canadiens estiment que l'accès physique et le support financier des aînés, ainsi que leur sensibilisation quant à des soins de santé bucco-dentaire appropriés, sont un problème sérieux. Plus précisément, 86 des Canadiens estiment que les aînés sont confrontés à des contraintes financières qui les empêchent de payer des soins de santé bucco-dentaire, une hausse de 6 par rapport à 2022. Une forte majorité, 81 des Canadiens, estiment également que le gouvernement ne finance pas adéquatement les programmes s'adressant aux aînés qui leur permettraient d'assurer une bonne santé buccale, ce qui représente une hausse de 9 depuis 2022. De plus, un peu moins de la moitié des Canadiens présument encore que les services de santé bucco-dentaire dans les établissements de soins de longue durée sont soit inexistants ou minimes. Ces chiffres indiquent que le programme de soins dentaires du gouvernement est vraiment nécessaire. La CHD a été encouragée de voir le gouvernement du Canada investir sérieusement dans la réussite de ce programme et le gouvernement sur la réussite de ce programme. Il y a un consensus clair et croissant entre les Canadiens et le gouvernement sur le fait que les services de santé bucco-dentaire sont trop insuffisants depuis trop longtemps et que cette situation doit être rectifiée. Lorsque nous nous sommes penchés sur les soins bucco-dentaires des personnes âgées, nous avons demandé aux Canadiens si, selon eux, la santé bucco-dentaire devait être incluse dans la norme nationale pour les soins de longue durée. Une écrasante majorité de Canadiens, 92 d'entre eux, convenaient que la santé bucco-dentaire devrait être une norme nationale dans les soins de longue durée. Nous nous félicitons de l'inclusion des soins de santé bucco-dentaire dans la toute récente publication de la norme nationale pour les soins de longue durée, qui a été publié en janvier dernier. Mais, par contre, des stratégies de mise en œuvre et d'application et de suivi sont nécessaires pour que nos aînés reçoivent les soins bucco-dentaires qu'ils méritent. Ces chiffres signifient que nous sommes sur la bonne voie, mais aussi que les Canadiens, dans la grande majorité, estiment que l'accès aux soins de santé bucco-dentaire doit être amélioré et soutenu par le gouvernement. Les hygiénistes dentaires se réjouissent de prodiguer des soins aux millions de Canadiens qui auront désormais accès en vertu de ce nouveau régime canadien de soins dentaires. Alors que nous célébrons la Semaine nationale de l'hygiéniste dentaire, si vous voyez un monument de votre communauté illuminé en violet, c'est la couleur de l'hygiène dentaire, la couleur de la passion. Je vous demande de réfléchir à l'importance de la santé bucco-dentaire et au travail que font les hygiénistes dentaires partout au pays pour prévenir les maladies bucco-dentaires. Dans les années à venir, nous nous réjouissons de sensibiliser les Canadiens à leur santé bucco-dentaire et à ces nouveaux programmes. Nous continuerons à travailler sans relâche pour réduire les écarts d'accès à des soins universels pour tous. Merci.
I wanted to start by asking you about issues related to access to dental care. A survey shows that 7 in 10 Canadians make an appointment with their dentist, but having insurance isn't the only barrier to that. So I'm wondering, that other pot of money that the federal government put forward to address access issues, how would you like to see that money spent?
Well, access to care is a critical importance, and that's why dental hygienists are ideally positioned for that. As I mentioned, dental hygienists can practice independent of a traditional dental office. So we have many dental hygienists who actually have mobile practices, and they're going to communities where maybe there isn't a dentist, and they're providing care, and they can refer out to communities. We also, and we find that very, very effective in terms of improving access to care. And also in terms of long-term care homes, we have a number of dental hygienists who actually have contracts with long-term care facilities, and they go in and provide oral health care for those residents of long-term care homes. But this funding will actually help ensure that there's improved access. So those that can afford access right now can actually have access to oral hygiene and dental care.
I also wanted to ask you about NIHB benefits. I'm wondering if you have any experience with these benefits, what you think of them in terms of the adequacy of care that people receive under those benefits, and whether that would be an appropriate model for this new expanded dental care plan.
So NIHB is a program where provinces and territories come together and decide on the services that will be reimbursed. And then there's a fee guide per province. So definitely there is an assessment of what is the need out there, but it varies from one province to one province. It is a good program in a sense that there is coverage for people that would not have access to dental care. Is it something that we're looking at? I think that we've been working very closely to having a national standard of care so that whether you reside in British Columbia or Ontario or the Maritimes, you will have the same access to the services. So that's really what we are focusing on, is having this national standard of care. So, and it is equitable for all Canadians. And then we'll have to decide on what those services will be and the platform and to which, who's going to be responsible to administer the program and the reimbursement rate if we're going to go to something that's similar to an IHB.
Is there a gap in the NIHB coverage that you'd like to see addressed?
Definitely. And NIHB does not cover a lot of prevention, which is really our focus at this point, because there's definitely a lot of research that support that prevention is key in order to enhance and change the outcomes at the end. And that's what we're looking for. We are really looking at services that will reduce the risk or the burden of disease. So it is gingivitis, caries. We want to see those numbers go down, because definitely our statistics are not necessarily very nice in that field. So, yes.
Could I just ask, you mentioned that 250,000 children had been to the dentist in the first phase. Do you know what proportion of them went to a hygienist?
Unfortunately, we don't have that data. We would love it.
And the other question is, my understanding is that as part of this program, there may be an ability to top up public insurance to cover gaps, for example, in coverage. Or, for example, if the coverage is too low, it won't cover all your kids or something like that. There are many families who do have insurance, but it isn't enough to cover all their kids, so they have to choose between a hygienist appointment or go to the dentist or almost ration it within the family. Do you think that those families who do have some insurance, earning under 90,000, but it isn't adequate to cover, say, a hygienist appointment, should under this programme have the ability to get a top-up?
We recognize that there are gaps in terms of people who have coverage in terms of their ability to pay. However, this program is a first start, and we commend the government as a first start. Ideally, once this program is rolling, then they can identify future gaps in terms of access to oral care. But from our understanding and working with government, this program is intended to address people that have no access through any kind of workplace employer program, even if there are gaps in terms of the ability to pay.
Can I ask one more question? I don't know if there's anyone else waiting on the phone. The question you asked in the surveys about support for a national dental plan, it was put to people that the plan would cost $3 billion. It's now $13 billion. Do you think that would have changed the results?
That would be asking me to speculate, but in terms of our conversations with members who deal with patients, I don't think it would have, because they want government to commit to improving oral health care of Canadians. It has such long-reaching impacts on the economy and in terms of the overall health.
I have no questions online, so keep going.
If we could return to the NIHB just very quickly, if the benefits package in this new insurance plan exceeds the NIHB, what would you like to see happen to the NIHB coverage?
That's another discussion, because I mean, what's going to happen at that point is that depending on what type of basket of services, if you want, is going to be part of the federal program, then NIHB will probably going to sit down and see whether or not that they need to revisit some of the services that they're not offering at this point or not paying at this point to increase or to match what the federal program is. Because it's actually treated as two different programs. But one would think that there could be an impact in where more prevention could actually be now covered through NIHB if prevention is key for the federal program.
On the sort of mobile hygienist side of things and improving access, what kind of programs could make that happen? Are you envisioning that the federal government would fund some of these mobile clinics, or how exactly would you like to see that money used?
I think it's not funding necessarily, because the program itself will fund something, we would think, because we are requesting that there'd be a code for actually a mobile clinic. Because if you set up a mobile clinic, you're not necessarily seeing 7, 8, or 9 patients a day. You would probably see 2 or 3, because you have to set up and do the back and forth. But definitely at this point, there is provision in fee guides for people that offer mobile services, so they get a little stipend, an extra, because of the mere fact that they need time to set up and do their sterilization outside the area where they provide care.
So it could pay for itself, essentially. What about in terms of this fund to improve access? How would it go toward training more hygienists?
We don't have any information on this fund to date. We're in constant conversations with government, and our next meeting with government is in June, and so we look forward to those discussions and providing input into how this fund is going to be actually developed and how it's going to improve access to care.
Could I just ask a question about how the money will get to families? I know in the first tranche they were simply sent some cash, and I suppose they were trusted to spend it on dentist fees, not the gas bill. I mean, in this one, my understanding is that there will be some kind of a reimbursement system, very much like traditional insurance. So you'll be paid for after you've been to the dentist or even before or whatever. I mean, what's your understanding? And can you tell me a little bit about the top-up? Like what proportion will be topped up if you're earning between 70,000 and 90,000?
You'll have to do a copay. That's our understanding, is that if you make over between $70,000 and $90,000, there will be a copay for the services. I don't know. I don't think the government has got down to that level of detail in terms of the amounts yet, but I do know that it's fully covered up to $70,000, and between 70 and 90 there is a copay.
Do you favour the money being sent directly to the families, or to have a system where the actual hygienist appointment is reimbursed?
As long as this system that is set up has quick adjudication of claims and that it's streamlined and easy to use for both patients and providers, then that's great with us. We also it's good to have data too. We want to ensure that there's research that goes along with this, and that there is that whatever program set up, that we actually can evaluate the success of the program by collection of data for the claims experience.
If you see a sudden influx of people wanting to go to the hygienist for the first time in their life, and obviously that would be create a bit of a burden for you, do you think there's enough hygienists around to cope with that?
Well, hygienists across the country welcome preventative care, and I think our independent hygienists would welcome the influx of new patients to their practices. And we see more and more dental hygienists every day initiating their own independent dental hygienists and actually being able to provide services directly to their patients and clients across the country.
Just really quickly, the minister spoke about the reason for the big increase in the cost of the program, going up $7 billion more than they initially thought. And one of the things that he said was that people who've been uninsured for a long time have more complex dental needs. As you're adding people with disabilities and seniors to the people who qualify this coming year, can you just illustrate some of the lingering dental issues that they might have that might be driving up that cost?
Well, as you know, people that do not have dental coverage are the people that are not visiting a dentist because of cost. So that's the number one barrier. So it'll be from strictly having just an exam and potentially a lot of caries and a lot of teeth that would need major restoration. So that's why I think that everybody's is under the understanding that the first couple years of the program, if you have an influx of those patients that have not seen a dentist for 5, 10, or 15, or 20 years or ever, there will be an extra cost to the program at the startup. But then it should, over time, go down.
And what kind of issues might those folks have been living with for a long time?
Well, as you know, a lot of people, if they're in pain, oral pain is very taxing. So they will go to Emerge only to get a prescription, and then they're not treating the issue. So that is one thing that we are going to see a difference, is that less people will go to emergency. They will go where a treatment can be rendered. But definitely, the caries rate is going to be very high, and people will we're going to see a lot of extractions needing to be done over time before we get them to a level of prevention that we can maintain what they have in their mouth, or if not, remove everything and then put in any type of dentures or partials that they would need.
Can I just following up Laura's question here on that? I mean, professionally speaking, if you have someone who's never been to the hygienist or not since they were a kid, or for 20 years because they couldn't afford it, I mean, do you sometimes have to have several appointments to clean up their teeth? I mean, how labour intensive is it? And can you just go into the technicality of what kind of things you do see in people who haven't been regularly at all, compared to people who go, say, once a year?
Well, a routine appointment will be anywhere between 30 minutes and 60 minutes, but people that have never visited a dental hygienist for a number of years, depending on what they have, it could be a 2, 3, 4-hour appointment. Sometimes we will break down the mouth into four quadrants and spend an hour in every single one of them. And then we will see them back in 2 or 3 months to reassess for a period of time until they're stable. So definitely, we will have to see people for longer appointments, possibly. But interesting enough, we can't predict. We don't have a crystal ball when somebody calls and haven't been to a dentist for 10 or 15 years. Sometimes they do come in and they don't have, that much to do.
In your experience, if someone hadn't been to the dentist at all for a long time, would the dentist tend to send them to you first if their teeth were in bad shape, just to clean it up before they could get into the nitty-gritty of caries and all that stuff?
Yeah, to prevent infection, absolutely. Before any type of treatment is done, whether it's restoration, whether it's pulling a tooth, we usually clean the area first to remove any infection that is already there, so that if we're pulling a tooth, healing is quicker and faster. Absolutely.
Good.
Thank you.